Brooke, there's been a lot of discussion after Senator Steve Huffman gave a comment asking if the African American and minority communities, their hand washing techniques might have anything to do about their the health disparities when it comes to COVID-19. Now, while there's no research or data that backs that, there is research that shows that there are health disparities. I spoke with two health professionals who tell me why. In a statement, District 5 Senator Steve Huffman says in part that he, quote, regrettably asked a question in an unintentionally awkward way and was trying to focus on why COVID-19 affects people of color at higher rates. Montgomery County is a prime example of the national disparity.
African Americans make up 35% of the cases, but yet only 23% of the overall population.
Health officials say obesity, smoking, and heart disease can cause COVID symptoms to become more serious and even deadly.
So if you experience racism throughout your life, there's situations there that will lead you to react in ways that will lead to potential obesity, smoking, and heart disease.
And exposure to COVID can increase the chances of contracting it.
Use of public transportation, jobs that don't allow working from home, lower income may be equivalent to making more trips to the grocery store and the pharmacy.
Doctors stress that African Americans are battling the same pandemic as those who are white.
There's nothing different about what minority communities can do to prevent COVID. It's the same issue,
but without certain advantages.
We're talking about changing the way that they access health care. We're talking about changing their access to education. Working together as a community, that's something we think we can really get done.
Dan Ceppoletto says that the state of Ohio is working to direct testing toward minority communities in order to address this health disparity. And Tip City, Aaliyah Williamson, 5 on 2.
And new today here on 5 on 2, a new survey from